Can music touch the heart? Here to discuss this question with moderator Dr. Peter Libby of Harvard and Brigham and Women's Hospital are Renée Fleming, soprano and artistic advisor, John F. Kennedy Center for the Performing Arts, Dr. Jacquelyn Kulinski, Director of Preventive Cardiology at the Medical College of Wisconsin, and Dr. Sheri Robb, Professor at the Indiana University School of Nursing.
Hello, I'm Peter Libby from Boston's Brigham and Women's Hospital and the Harvard Medical School, and it's my pleasure to moderate today's session on Can Music Touch the Heart? I'd like to get right into the subject matter and ask our special guest, Renée Fleming, who's really been at the forefront of the intersection between music and wellness, and tell us about some of the initiatives that she's been involved with to really bring some science to this topic.
Yes, thank you, Peter. It's great to see you again and to be here with all of these extraordinary panelists. I have been passionate about this intersection of health and the arts, and especially music and neuroscience. I had the good fortune to meet Dr. Francis Collins a number of years ago at the same time that I was appointed creative consultant to the Kennedy Center. And we decided to bring the two institutions together with the NEA and Deborah Rutter of the Kennedy Center. And it's been an incredible journey because we've provided a platform for science with the public. And I do believe, honestly, that things happen much quicker in healthcare when the public is behind it and when they start making noise about it. And the fascination with not only the basic science of evolution, of even animal science, is so extraordinary. But then when you add these initiatives that really help people who have diseases of aging, who have child care, in terms of childhood development, and so many different intersections. And it's really been a joy to watch the sector grow. It's growing in leaps and bounds. There are so many initiatives now, and I feel like these things are coming to fruition in an important way.
Well, it's great that you've been a catalyst to bring these two worlds together. You know, the musical literature and texts of vocal music are just replete with imagery of the heart. And I wonder if you think that there's a special connection with the organ that I study.
Well, I remember at a very early age talking about heartstrings. You know, that song really played my heartstrings. Also having a very strong affinity to folk music and wondering if that was universal, if that was something that everybody shared. I suspect that we do. And now we know, actually, from what we've learned about evolution, that it's been with us since long before speech. So reminding people of the ancient history of our relationship with creativity, and particularly with sound, with music. Vocalism probably occurred before speech. So it is really part of our DNA. And with each passing day, science learns more about it and is able to apply it to our health. But I always knew, for instance, that singing made me feel great. It made me feel somehow connected to my body in an important way. And in fact, Deepak Chopra said, Renée, you're so lucky to be a singer. It's the best connection to the vagus nerve. So every day has been a learning experience for me.
Well, your singing makes us feel good too. Let me turn to Jacquelyn, who is a fellow preventive cardiologist. And you've really performed some pretty rigorous research with the connection between music and the function of things like the endothelial cells, which are important in cardiovascular control. So maybe you can tell us a little bit about that.
Of course. Thanks, Peter. First, I'll just start by saying that my research on music and heart disease, while both promising and exciting, is still somewhat in its infancy. It started just a few years back when I received a small pilot grant from the Medical College of Wisconsin to support a collaboration with a neighboring university and professor of voice. I wanted to study the acute impact of singing on vascular endothelial function, as you mentioned. And just a quick summary, endothelial cells are that single layer of cells that line the inside of our blood vessels. And when this important layer of cells is injured or damaged, it becomes prone to plaque formation and development, which forms that milieu for a future heart attack. We have a vascular core lab here at MCW that has special expertise to measure the function of these cells non-invasively. And this is important because improvements in vascular endothelial function, whether it's with medications or exercise or singing, translates into a lower risk of future cardiovascular events. For this pilot study in particular, all patients that were coming to our cardiology clinics were eligible to participate, and some were much sicker than others. Subjects watched a sing-along video that included a vocal warm-up and singing of the national anthem to various tempos and rhythms. I like to call this a proof of concept study, but what it showed us was that just 15 minutes of singing resulted in an acute improvement in vascular endothelial function. Furthermore, we found that participants who started off with impaired vascular function actually had the most improvement in vascular function after singing. These are the findings that led to my R61 grant from the NCCIH and NIH, where we now focus on singing interventions in older adults with established coronary heart disease. And this study is in its second year of enrollment.
Well, that's great. So your research has really connected the dots in a scientific way between what we know intuitively about music and change in physiology and actual improvement in vascular function. So that's really important contribution. Thank you so much for providing that scientific foundation. And let me turn to Sheri. Sheri, you have more boards than I can imagine, including being a musical therapist. And so when you engage with patients in musical therapy, ranging from kids to adults with different preferences for music, how do you choose what kind of music intervention to use for an individual in front of you?
Oh, and that's the wonderful part about what's happening with these initiatives, where we're beginning to study not only whether music can work in certain clinical populations for different outcomes, but also a better understanding of how music works. So really the first step for a clinical, when a clinical music therapist is working with a patient or a family, is to do an assessment. It really starts with a conversation centered on the problem that we need to address. So just like research, the problem drives the questions. In clinical practice, the same is true. The clinical problem is going to drive decisions about what music to use. So for example, music to address gait rehabilitation in a patient recovering from stroke would look very different from the type of music experience that a therapist would choose to support, say, social connectedness between partners where one of those partners has advanced dementia. So in the case of the gait, knowledge about the rhythmic qualities of music and how that affects neural firing patterns in the brain and then translate into an effect on motor patterns drives the selection of music. Whereas in the second case, singing together or perhaps dancing together, using music that was meaningful to that couple and from their young adult years would probably be the choice, because we know that these meaningful experiences with music are encoded memories that remain preserved for patients with dementia. So those are just two examples of how the problem and the knowledge base that we're gaining through research drives the application of the music.
Great. Let me ask a professional musician, Renée, how you select a particular type of music for a particular type of encounter.
Well, I think people are at the moment, this study in particular looks at classical music, but the group that was studied, actually, they were all, I think, in their 60s and older. They lived in Italy. They had probably a stronger cultural connection to classical music than certainly we do in the US. And I think also me as a classical musician would look at the list and say, well, a huge number of selections on this list, we would call new age music and not classical. So this, this kind of figuring out lists or playlists by genre is a little bit tricky. I think it might be more interesting at some point to think about tempo, to think about the length of phrases, which would dictate a bit of a calming influence, the volume. If the volume isn't changing all the time, then that also will kind of indicate that it's a little bit more calming, because that's really, and then of course the biggest thing is the taste of the listener. So if the listener could, from those elements, choose a playlist of music that they particularly gravitate towards, it might be more useful for them. So
let me turn to Jacquelyn again and ask what the implications are of music therapy for different types of heart disease. I guess there was a recent study, and you guys wrote an editorial to accompany it about an intervention with music in patients with heart failure.
Yeah, so I'll say that the impact of music therapy on different kinds of heart disease is not particularly well established. There are very few studies that are well done with the scientific rigor required to really discover the truth, so to speak, and to establish best practices in this field at this time. However, with the initiatives such as the Sound Health Partnership with the NIH, support from the National Endowment of Arts, Renée Fleming, and others, we will learn so much more about the role of music therapy, not only in heart disease, but other disease processes as well. Now, that said, the endothelium of the blood vessels that I study also plays a critical role in valvular heart disease, stroke, and congestive heart failure. Therefore, I am very optimistic that music therapy has the potential to benefit all different types of heart disease. And your question, Peter, I think also depends on the outcome of interest. So you're referencing this, the same study that Renée was talking about, this multi-center trial out of Italy, where they randomized the heart failure patients to listening to 30 minutes of classical music per day or a control standard of care group. And then after 3 months, they showed greater improvements in quality of life in the classical music group, quality of sleep, anxiety and depression levels, and even cognitive performance. But overall, there have been few other studies looking at longer term interventions and the sustained effects of music on health. And furthermore, we currently don't have any studies of music and hard cardiovascular outcomes, such as hospitalizations or cardiac events. I think more work needs to be done.
So there's been a lot of work in the cardiology literature looking at sort of classical physiology. You've looked at something a little more modern, the endothelial function, but now we've entered the era of functional MRI. And I took a quick look at the literature, and there's quite a bit of noise in the literature of functional MRI that with music, different types of music, different parts of the brain light up. But this is a great tool, but it seems very descriptive now. Can any of you bring me up to date on if there's any real insights from the functional MRI to really make a connection between the brain and music or the type of music?
I haven't heard about anything that the type of music is especially, I think, challenging to dictate through an fMRI. I mean, I was part of an experiment at the NIH. Actually, I participated for 2 hours in an fMRI machine, listening, singing, and speaking, and they could establish what parts of my brain were activated. The most powerful, interestingly enough, was imagining singing. So this is kind of where I believe that type of research is at the moment.
Great. Well, we know that there's some natural intrinsic rhythms, like there are waves of blood pressure. The physiologists call them Meyer waves, and they have a 10-second periodicity. And some of the researchers in this field have pointed out that certain Verdi arias, Va Pensiero and Lieti Calici, have a period of 10 seconds. And I think they did an intervention where they had people saying the Ave Maria in Latin 10 times, or 50 times actually. And they found that the Ave Maria is exactly a period of 10 seconds. And that it didn't work in other languages because it's longer in other languages. So I guess there's something about these natural rhythms that are intrinsic in us, maybe, Jacquelyn, related to our endothelial function and the periods of music.
Yeah, Peter, that's an excellent observation. I think a really important one too. There are a few studies out there that look at music, rhythms, and the timing as it relates to kind of the natural body functions. And for example, looking at periods of singing that correlate closely with a normal resting heart rate may potentially have more of an impact on calming and relaxation, for example.
It makes me wonder if songs like Amazing Grace, Leonard Cohen's Hallelujah, because these are the songs that are universal and so powerful that it's undeniable that they stand above other music as really reaching everyone, and be interesting to know if they all share that quality.
Yeah, and you think of the literature of the Lutheran chorales, which were written in the 16th century, and we hear them, of course, Bach made a huge use of them. But even if you go to Die Meistersinger, there's a Lutheran chorale there, and there must be something about that organization of the chorale that speaks to us as human beings. So let me just ask people one by one where they think we need to go next, because we have all these resources, we have this heightened interest and acknowledgement of this link. So Jacquelyn, in your research, what would be your top question, your top next priority? What's your next grant going to be on?
Oh, great question, Peter. And of course, I have thought about this already. So my next grant would be looking at music therapy as a form of cardiac rehabilitation. So the way that I would probably structure it, to be honest, is have, a traditional cardiac rehab arm, and then another maybe traditional cardiac rehab arm that also incorporates music therapy. And then compare those two arms for at least 12 weeks, which is the typical duration of cardiac rehab, and look at other endpoints, not just quality of life, but things like medication adherence or recurrent hospitalizations, recurrent cardiac events. I think it'd be really neat to learn more about this.
Yeah, very important in the care of this very vulnerable and sick population. So that sounds great. So Sheri is a musical therapist and actually engaged clinically in the use of music therapy. What's the next big thing?
Yeah, so my area of research actually centers on using music to address interrelated stress that children with cancer and their parents experience as they're going through cancer treatment. So, for the past 10 years, my research is centered on understanding the psychosocial mechanisms of action. So what are the social functions, the behavioral functions of music that can help regulate emotion and lower stress during cancer treatment. But most recently, from the same funding mechanism through the National Institutes of Health, our team was recently funded to now look at the biological mechanisms of stress. So we're able to look at cortisol and immune function and see whether or not music can affect those pathways. And our next step would be to take our findings from both of those trials to actually have a more holistic understanding, not only about the biological pathways, but also the psychosocial. So we get to have a psychosocial biobehavioral framework that really can help us to start understand how active music experiences can lower stress. And that has implications for many populations.
And maybe particular reflection now that we're in this pandemic and people are facing anxiety and depression. And so I think your broad swath is really valuable. And so let me close then with Renée, because you really brought us all together and you've been the champion of this interface and really have had a foot in both the science camp and the artistic camp. So where do you think we need to go next? What should be our job for going forward?
Well, when I say that the interest in the sector is exploding, I can give you a couple of ideas. Number one, the NIH has 22 working groups from their various institutes, and that is so unusual that they would work together in this way. And they're embarking really now on a look at the disorders of aging, which is so important. It will increasingly affect more of the population, the world's population, in fact. And they're finding that this type of integrative medicine and adding music interventions, which of course are inexpensive, everyone can sing. You don't need an instrument. You don't need any training really. And they're certainly important to kind of think about in terms of what medicine will look like in the future, kind of addressing the fact that we need cohesion, we need some kind of social interaction. All of these things are being acknowledged now. Mental health is becoming so much more important. Then there's NeuroArts, which is an initiative that connects Johns Hopkins with the Aspen Institute. And Susan Magsamen of Johns Hopkins has created this extraordinarily ambitious notion that all of this will become a field, which is different than an initiative or a conference or people kind of looking at us as though this type of work belongs on the fringe of healthcare. In fact, she's also thinking in terms of our general well-being. So throughout the lifespan, how do we keep from getting sick? which of course all of us would love to know about. And then sound health has now found a home at UCSF, thanks to the NEA, and the people working there are great minds, will become a resource center for all of this, and they will drive the field forward as well. So I'm incredibly excited and honored and thrilled to be part of this.
That's terrific. Well, it's been wonderful to learn from this panel of people who have brought the human side to science. And Renée, your humanism really is a wonderful addition. And this is just the beginning. I have the feeling you've just taken the lid off this field. So thank you all.
Thank you, Peter.
Thank you.
Thank you.